Endocrine pathology, hyperparathyroidism. All right, so for these hyperparathyroidism pathologies, it's relatively straightforward. It's talking about an increase in PTH, okay? Regardless of where it's coming from or what's causing it, we'll talk about it. So primary hyperparathyroidism is usually secondary to parathyroid adenoma or hyperplasia. So it's coming specifically from the parathyroid, and that's why it's called primary hyperparathyroidism. So what are we going to see? The main finding is hypercalcemia, secondary to the increase in PTH production. Now, what they love to ask is the symptoms of hypercalcemia. You know those symptoms. You have an increased risk of kidney stones, of you go and urinate a lot more than normal. You have hypophosphatemia due to the increase in PTH. You get constipation, as well as bone pains and neurological disturbances. Specifically with primary hyperparathyroidism, they like you to know this specific pathology of osteitis fibrosa cystica. And all that is, it's known as brown tumor syndrome, or I guess pathology is known as brown tumor. And what happens is that we have cystic bone spaces filled with brown fibrous tissue secondary to the increase in PTH, because PTH is going to be constantly resorbing bone, okay? And so what we're going to be seeing is subperiosteal bone resorption. And they like to ask you, or they want you to know essentially what's happening at the bone specifically. So you have to memorize that it's subperiosteal bone resorption, and that's secondary to the increase in PTH. Okay, and that's osteitis fibrosa cystica, and you're going to see brown tumor. Next is secondary hyperparathyroidism, and this is always going to be kidney disease involved. Okay, so secondary to kidney disease. So if a patient presents with chronic kidney disease, CKD, start thinking about secondary hyperparathyroidism immediately. Now the question is, why does that make sense? Well, if I have chronic kidney disease, that means that my kidneys are unable to reabsorb calcium in an effective way, and we can't get rid of phosphate in an effective way. So phosphate levels are increased in our blood, and calcium levels are decreased in our blood. So PTH senses this, and it causes an increase in production of PTH, hence secondary hyperparathyroidism. It's not coming directly from the parathyroid glands. It's coming secondary to chronic kidney disease, okay? And when we have an increase in PTH, it's going to cause a severe effect of bone resorption. It's trying to get calcium in any way possible, but you're just going to be losing it to the kidney. We can't reabsorb our calcium, and we're going to see hypocalcemia, a decrease in calcium. So those are the two stark differences. With primary hyperparathyroidism, we're going to see hypercalcemia, and it's going to be coming secondary to maybe parathyroid adenoma or hyperplasia, so it's coming from the parathyroid gland. However, secondary hyperparathyroidism, you're going to see hypocalcemia, and secondary to chronic kidney disease. Very important to know that difference.